Jeanie, welcome to the show.
Thank you, Jamie. It's so great to be here. I feel honored that I can share my story on such a wonderful podcast that's touching so many people's lives.
Thank you for coming on. And Jeanie is coming to us. She has been pregnant at 42, 44, and 48. Amazing. Now, she tells me that her first two pregnancies were natural. We are going to be sharing her story at 48, but she's going to be referencing her other pregnancies.
I was young and growing up in a very strict Catholic family to learning how to find my way through that. And I met and married a Catholic man, I think because that was expected, and quickly found out that wasn't the right path for me and went through a divorce and just a lot of life experiences. I went to medical school at a later age in life. I was 30 and I was in a place where I knew I needed to do that. At some point, my traditional Catholic parents said that it wasn't a good occupation for a woman to be a physician. So it
Really?
took me a while, to figure out, gosh, I really want to do this. This is something deep inside me that I need to do for me. So at 30, I went to medical school and I became an anesthesiologist, and then now I'm a fertility doc. So definitely my life has taken me in many different directions, and it's been really fulfilling and wonderful and a lot of struggles at the same time. So it's very colorful, I guess.
Amazing. And don't worry, I have some questions for Jeanie at the end of the show regarding fertility. Don't worry about that. And jumping in, can you tell us a little bit about your journey to motherhood and kind of how it started at 42?
Absolutely. I always pictured myself as a mother and having multiple children. Sometimes I've actually had a fertility reproductive endocrinologist ask, well, how many kids did you want like growing up? And the number that came to my head was five. That's a lot of kids. So it was interesting that I got to my late 30s and almost 40, and I wasn't married and didn't have kids. And I I ended up meeting my now husband on Match.com.
Oh,
And
fun.
yeah, luckily I was 39 because I think that was his cutoff. I was turning 40 the next month. And we met, and I knew I wanted to go on another date. And then, just another date and another date. And we knew that we wanted a year later that we would definitely get married. And my husband had placed on his Match.com profile, definitely want kids. I had been a little bit more on the possible. My terminology was possible, and that was mainly because I knew I was older and I had never had a huge energy reserve even when I was younger. So I knew it needed to be the right partner that was willing to help out and be part of raising a child. And also, I was concerned about the biological genetic piece of it. Like, would we have a healthy baby at this point in our lives? Or I was thinking about me for my profile at being 40. What would that look like? Would we have a healthy child, or would we potentially have a child with genetic problems? Or was I willing to take that risk? So these are all thoughts in my mind. And then when my husband's name's Jeff, and we met and talked over that first year of dating, and we're both like, we want to do it. We want to do it. We want to take the risk. So we weren't married. We're both, I especially told him, honey, we don't know if we're fertile. Or he had never had kids. He had been married before. He had never had kids. I had never had kids, never really tried to have kids. So we didn't know. And so we're like, okay, we'll be open to it because who knows? Maybe it'll take a really long time, even if we can get pregnant. We were so fortunate. The next month we happened to get
Wow.
pregnant. Yeah, we didn't know. We went to an adoption meeting because that was definitely a part of our potential having a child plan. And I left that meeting. I didn't know I was pregnant at the time. I left that meeting feeling so discouraged because it sounded like this was our local adoption place. And I'm not saying this is how it is everywhere, but it sounded like the parents of the child, or usually the mother who's adopting out the child, chooses the adoptive parent, and they usually choose a
Mhm.
younger couple. And I knew that, oh, already we have a mark there. So I left that meeting feeling pretty rejected. And then it was shortly after that we found out we were pregnant. So a really beautiful, amazing gift, absolutely. And that's our son. He's now 8 years old and just fantastic. And I'm so in love, so in love with him. And then a year later, it comes to, we get to the same discussion point.
Mhm.
We, I had told my husband up front, if we have children, I don't want to just have one child because I'm an only child. And I've always wanted brothers or sisters. Loneliness was sort of the theme of me growing up. And I have really good girlfriends that are like sisters, which is wonderful. But I don't have biological brother or sister. And I wanted to make sure that we could give that to our son. And so we got to a year, he was a year old, and we started the discussion again. Do we look into adoption again? Do we try for a biological child again, with our ages being even older and the risks being even higher? And we decided, yeah, let's do it. So that time of trying for a child and conception was a very long time journey for us. It was a year and a half it took us to get pregnant with Lily Rose. And I'm trying to think what what we were what our journey was like as far as trying different options. We went to a Chinese medicine doctor that was recommended by one of our friends. He was wonderful. However, we just eventually, after maybe a year of working with him, I don't know, it was quite a while, we decided, hey, we've tried acupuncture, we've tried herbs, we're not getting pregnant. And interestingly enough, it was when we stopped that piece of things, maybe we just let it go. I'm not sure what the magic was. I remember actually being sick, like having a cold, and then finding out we were pregnant. I was so overjoyed and excited. And honestly, there was nothing on my radar as far as pregnancy. I mean, maybe I was a little concerned that, will this pregnancy be genetically okay? But that was about as far as risk wise that I was concerned about. I had no problems with Miles. He was born on his due date. I mean, some maybe minor things with my pregnancy, but nothing at all. It was really pretty smooth sailing. So nothing was on my radar with the second pregnancy. And then we got her genetic test results back at 10 weeks. And we all, as a family, listened to the report, and she was a girl and genetically no problems. And we were just thrilled and over the moon excited. And then that joy and love, well, it never went away. It was always there. But unfortunately, we also had a lot of sadness because we ended up losing her at about 13 and a half
Mm.
weeks. And honestly, yes, I'm surprised I'm not crying right now, and I might, but that's the hardest thing that I've ever gone through. And I had no idea what pregnancy loss, miscarriage meant until I went through it. So my heart goes out to everyone that's had losses. To you, Jamie, I'm just so sorry. And I just remember thinking, oh my gosh, how do women, as an anesthesiologist, I would see women had seven pregnancies and no live births, or one live birth, or I knew they had lost 7 pregnancies. And I'm like, oh my goodness, how did they have the courage? How how strong they must be
Yeah.
to try again.
Yeah.
Especially at first, I'm like, oh no, oh no, this is so painful and so scary and so hard. But then there was healing involved,
Yeah.
and that's a whole another piece of my story. And for us, it was about 3 months later. I was like, honey, I'm ready. I'm like,
Yeah.
we were old before, we're really old now, and I am ready to have another baby. And my husband was like, okay. And I was like, you know what? I think we need to go the Western route of the reproductive endocrinologist. I think we need to go see what they have to say. And we did. And that ended up being another, what, gosh, I lost track of the timeline, but quite a while, a lot of ups and downs.
Mhm.
We did IUIs, multiple IUIs. We did IVF with our own eggs, and we basically that was not successful. And I had to mourn those losses too. Or we had 6 eggs and one embryo, but didn't make it far enough for transfer.
Mhm.
And so I was really sad about that. Yeah.
I wanted to say thank you for sharing that. I know how hard it can be to share your losses, and thank you. I know on this podcast, it's important to me that we all share our losses and not hide them.
Yeah, absolutely. There's so much healing. And for my husband and I, especially myself, and it was nice that he came and I had his support, but we went to a pregnancy loss group, and
Mm,
that was really, really healing for me. And I'm everybody's different, everyone's
yeah.
journey is different. And I'm not saying it's for everyone, but I just to know, yeah, just to know that I'm not alone in that suffering. And
Yeah, definitely.
thank
Yeah.
you. So yeah, the RE had said from the get-go, your best bet is donor egg. And my husband was like, absolutely, let's do it. He's all about like, statistically, if you have better chances, let's do that. I guess I just wasn't ready for it. So
Mhm.
we tried with my eggs, and she said, you've been pregnant twice and had a genetic, your second pregnancy genetically looked okay. It ended up that I had a incompetent cervix is why we
Mhm.
lost our second pregnancy. So she thought it was worth a try, and that's what we did. After healing from that, again, it was that same feeling where all of a sudden it's like, I'm ready. Like, I want to be pregnant and let's do donor egg. And it's like, okay. And we had a support group through our IVF clinic of donor egg couples that were in somewhere in the process of the donor egg. Oh, I found it so helpful. So I think it was even just one Saturday a month or something, but it was wonderful to see. I think we joined it before or when we were starting to consider donor egg. And so we were still in that phase, but that was great because we saw people at different phases and even people who are pregnant with their donor egg pregnancy. And then once they delivered their baby, then they weren't part of that piece of the group. They wouldn't be on the program anymore. Or
Mhm.
that we were meeting on Zoom because it was COVID time. So yeah, that was a great piece to have that
Yeah.
support for the donor egg group. And then yeah, we needed to choose
Can I go back to
what's
the
that?
support
Yeah.
group? Was this specific to your clinic?
Yes, yes.
Oh,
And yeah,
okay.
yeah, which
How
I think is
nice.
a great idea. Absolutely. Not that people across the country can't form a support group. That would be great too. But we happen to have it just within our clinic. And there was, I think, uh, not psychiatrist, psychologist or a nurse or a nurse that kind of mediated the meeting. But for the most part, it was just couples talking about where they are in their journey and how they were feeling. It was lovely. And I met one of my good friends who gave me a bracelet that I found when I was looking through my pictures. And she was just so helpful in the journey because I had so much fear and anxiety about the pregnancy that maybe we would lose this pregnancy because we had lost our baby before. And just to have somebody walking through it at the same time, and it ends up her baby boy was born a month after our baby girls.
How
Pretty
fun.
fun. We're actually
Yeah.
going to his birthday party this
Oh,
weekend.
yay.
Yeah. So yeah, well, I should say, we went to maternal fetal medicine specialist to talk about this pregnancy, especially after the loss. And they decided most likely we lost Lily Rose because of cervical insufficiency, even though it normally that happens a few weeks later in gestation. But when the baby is heavier and the cervix can't hold the baby in, but they said it looks like it probably is. So we're gonna say that's probably why you lost her, and we recommend putting in a cerclage, which is basically a
Mhm,
stitch through your cervix.
mhm.
So that's what they did for our pregnancy with Eva Hope. And then at 36 and a half weeks, I believe, they recommended cutting that stitch. And they say in that way, the reason why is they don't want they wouldn't want me contracting against a closed cervix that could move because of that stitch, because then I could have my uterus could rupture or
Yeah.
something pretty terrible. So that's what they normally do. And they did that, and sure enough, my water broke, and not right away, but it broke probably they cut it at 4 in the afternoon, and then I think like 2 in the morning my water broke. And yeah.
Let's go back to your transfer. What
Yeah.
was that 2-week wait like?
Oh yes, yes, oh yes. I forgot about that.
Mhm.
Yeah, that was a long wait. I did not do my own pregnancy test, which I hear some women
Really?
do.
Oh, yeah.
Oh yeah. No, I'm for the most part a rule follower. So I was like, okay, we're not gonna test. We're gonna get the blood test. Yes, I still remember. So the wait was long.
Uh-huh.
And I still remember when we did get the call. I'm gonna cry. We got the call, and my son at the time, so he's 6 years older, so he was probably 5 and some change. And we got the call, and we knew that was going to be the call. So we put it on speaker. My son was there. We're all on the carpet in our living room, and the nurse that called us happened to be, it was a weekend, and she wasn't the one we worked with all the time, but we worked with her once in a while. But she just had the personality that was a little more dry. And so she was like, well, I have your results. Oh my gosh, I thought they were negative the way her tone of voice was. And so like I had my heart dropped. And then she said, you're pregnant. I honestly can't remember the exact words, but basically we're pregnant. And oh my gosh, we were just so excited. It
Oh,
was
yeah. Now, you had your embryos tested for genetics and sex before you did the transfer?
That's correct. Yes, we had all our embryos tested, genetically tested, and we just ended up having 3 embryos that genetically looked great, and which were really good quality.
That's amazing. So,
Yeah,
after going through loss, what was it like for your first trimester?
it was really tough. I was so happy to have my good friend that I met through the support group, and we met for coffee once a week. And sometimes it was just a tea or something decaffeinated. And actually, she introduced me to matcha. I love matcha
Mm,
still today.
mhm.
And that was so helpful because I could just talk to her. She was going through it. She was pregnant as well, going through the pregnancy with a donor egg. I just felt like she was my rock when I had anxiety, and I could just talk to somebody about it, which was amazing. I did end up getting a Doppler to check
Mm,
her heart rate a little later in my pregnancy. I found that really helpful. So when I was worrying, I could find her heart rate and feel reassured. And I know that might not be for everyone. I'm used to hearing the tones in anesthesia, so my ear is toned to it, to the baby heart rate anyway. And for me, it was pretty easy to find. I know some my friend that I was referring to, she said that that wasn't for her because it just made her more anxious. But that was really, really helpful. And then having the support of my friend. And then actually the pregnancy loss group that my husband and I attended, they have a group called PALS, Pregnancy After Loss. And I attended that. My husband really couldn't, having a child, one of us needed to be
Mhm.
available for our kid. I mean, I guess we could have found a sitter, but it was most of the time me attending that. But that was a really helpful meeting as well, especially having other couples that have been through loss, pregnant again, and sharing just our fears about losing another pregnancy.
Yeah. And so what was the rest of your pregnancy like?
Yeah, I was so happy I was tired. I was so happy I was nauseous. I
Mhm.
was just so happy I was pregnant. Yeah, like just having a loss put things in perspective, most definitely. And yeah, a lot of joy looking back at the pictures when I was gathering pictures for this recording. I was like, wow, we had a lot of things going on. Having our 5-year-old son, and he's in kindergarten, and we were finishing our basement. So we have extra space. My husband was starting to work at home, and then I was starting this business, my Baby Hope fertility business. I say this business because I'm sitting here in my office. So I, yeah, looking back at those pictures, like, wow, we had a lot going on, and I surprisingly felt good. I was tired, but I was still able to function and do a lot of things.
Mhm. How did it compare to your other ones?
Yeah, that's a good, really good question. The nausea, I wasn't quite as nauseated with Eva as I was with Miles, my first pregnancy, but it was still there. And my nausea cleared up pretty much the end of first trimester for both of them, luckily. I felt very blessed with that. And different things made me feel nauseous, which was interesting from different pregnancies.
Mhm.
And I think during pregnancy with Eva Hope, I actually decided I liked beets, where before I could kind of take it or leave it, probably didn't like beets too much. But with my pregnancies, like, I like beets and I still like beets. So one interesting thing.
And how would you describe your pregnancy overall?
Yeah, I really think overall I felt great. Luckily, I didn't have any complications. Hmm. I My OBGYN was amazing. He said, you can come in every week. He knew what I had been through. He wasn't actually the doc on call when I lost Lily Rose. His partner was, and his poor partner is traumatized by it. He said, but they're both
Wow.
supportive. Yeah, I guess because it's not too common to see a cervical insufficiency loss, and she had moved low in my birth canal. So I asked him, do women usually take the baby? He said, it doesn't even look like a baby, kind of thing. And apparently he was pretty
Oh,
bad about it. I was like, oh, I know. It's like heartbreaking. But
yeah.
yeah, so my pregnancy with Eva Hope, I went in every week. I was like so happy to and reassured to see her on ultrasound, whether it was ultrasound or Doppler, both. Just that reassurance that, hey, things are looking good.
Yeah. Being 48, did your OBGYN mention that or have any concerns?
Well, I was seeing the maternal fetal medicine doc as well. So I think my age probably would have put me in that category. And then on top of it, having the loss in the cervical insufficiency definitely
Yeah.
brought me there. So he was very happy that I think at least at the end, I would alternate 1 week at the maternal fetal medicine and 1 week at my
Mm.
OBGYN. So he was very happy with that. The maternal fetal medicine doc put in the cerclage,
Mhm.
and that worked out really well.
And so for the sex, did you pick what gender you wanted when you
Ooh, that
transferred?
was a really good question. We decided to go with the healthiest one, and we
Mm.
did have one that, I mean, they were all really good quality, and the RE said all of them should do just fine. And a way of deciding was, hey, let's go with the highest quality. And honestly, I think we asked her not to tell us the gender at that time, but
Uh-huh.
then once we said go with the highest quality, then we asked what the gender was because I need to know personally. And I wanted to know with my son. We did genetic testing with him as well. Not that we would have done anything differently with the pregnancy, but we just, for me, more information is really helpful, like just
Mhm.
to wrap my mind around everything. So we found out about him as well.
Yeah, I like that. And was there any product that you could recommend that helped with pregnancy?
The first thing that comes to mind is that the handheld Doppler, I just got it on Amazon. As I mentioned, that was just a really nice reassurance. I remember going to one of my son's baseball games and I had a little bit of bleeding, and of course, like very like very scared, and
How
I
far
had the
along were you?
Doppler. That's a good question. I must have been I must have been about 7 months, maybe six
Mhm.
months, because it was in the summer and she was born in October,
Mhm.
somewhere in there. And honestly, I had a little bleeding on and off, and my OBGYN said sometimes your cervix can get a little more friable, and that's not too uncommon. It was definitely nerve wracking, but I was
Yes.
able to go. And of course, it happened on the weekend. And when my OBGYN's not in, because normally he'd be like, just come in the office, like check it out. And so, but I had the Doppler and I took the Doppler to the game, and I kept listening, and I could hear the heartbeat, and I'm like, okay, we're good. We're good. I'll see if there's more bleeding, maybe I'll decide to do something differently, but there wasn't. And that was helpful.
And how did you prepare for birth and baby?
Yeah, to, we went for our first pregnancy. We did a hospital class, and we looked into that for Eva Hope's pregnancy, and then decided, I had mentioned we went to the pregnancy after loss group, that the lady who heads that group in our area is a nurse, and she also does the birth classes. Actually, it was a private class. It ended up just being my husband and I with her.
Oh,
So that was
nice.
nice. She gave us a lot of great techniques and ideas. I know there were other classes we looked at. I, oh, we did the infant CPR. I think I actually did that because I had it scheduled. That's right. I had it scheduled closer to Eva's due date is when I could get into that class. And then she was born before it, but I was able to, when she had to stay in the hospital a bit longer, I was able to attend the class while she was still. And she ended up being in the NICU for 5 days. That was tough. She Normally when infants are born at the age she was born, it sounds like it could go either way. They could be just fine and go home, or they could need a little surfactant to keep their lungs open. And that's what ended up that Eva needed. And then while she was there, they said, oh, yeah, she's quite jaundiced. We should put her under the bilirubin light. It ended up a longer NICU stay than we expected. And
Mm.
being a physician, I was a little frustrated because I felt like they had a lot of sick babies. So I was trying to remember, oh my gosh, we're so fortunate that she's not one of those. She needs some help, and they're helping her, which is beautiful. And I was trying to focus on that too. But at the same time, they were so busy that I feel like she wasn't priority as far as like trying to wean her
Mm,
and stuff. They're kind of
mhm.
like, okay, she's doing fine. And I'm
Yeah.
like, yeah, she is, but I want to get her home. Like,
Yeah.
we can go home.
Going back to your pregnancy, what was your exercise and diet like?
Ooh, that's a really good question. I'm going to back up to Miles. I had a lot of time to exercise with him. I did a lot of swimming during the pregnancy. It felt great.
Mm.
It was easy on my joints. I loved the pool anyway, and I was a lot warmer. He kept me so warm as a baby, like, and he still to this day is like the hottest kid. It's so funny. So
Wow.
that was, yeah, that was my form of exercise. My diet looking back was not terrific. I've learned a lot since him, and it wasn't, I didn't eat fast food. So I thought, oh, I eat healthy. And now I'm realizing, oh, there's a lot more to just not eating fast food and being functional medicine trained and really focusing on diet as a super important lifestyle piece that can affect our health. Oh my gosh. I'm like, okay, like, thank God he was healthy. I was healthy during that pregnancy. And yeah, not that, again, not that my diet was horrible, but definitely could have improved, had a lot more vegetables. And
Mhm.
that's where I was with Eva, which felt really good. And I think that's probably why I felt so good at 48 being pregnant. I have to think that's a piece of it for sure. Is I had just gotten into a lot better habit, our whole family, of eating really clean meats, organic produce, cutting out sugar, cutting out, for me, I cut out gluten. I never thought I would, but that's has been a big difference in my life. I definitely ate really well with Eva Hope. Exercise, I didn't have as much time or didn't make as much time to exercise. I think a part of that was having a kindergartner, having a lot going on in my life, and just, yeah, just being busy and not prioritizing. I was so active with my son because he's so active that I'm never really sitting down. But, as far as like, I wasn't getting into the pool like I did with him.
Yeah. Yeah, that makes a lot of sense. Let's get into your birth story. You said at 36, they cut the, how do you say it? Collage? That's not right.
Cerclage.
Cir
Yeah, the
Cerclage.
cerclage. Yeah, it's just a little string. It's so funny how it can make such a difference.
But you can't touch it, can you?
Well, my OBGYN said some people can feel it. Maybe once in a while I would feel it, like not by touching it, but just like feel it in my vaginal canal. But maybe like if I really tried, I could. But yeah, it's they're not that long. The
Okay, you couldn't really notice it.
No, I really didn't. And I guess it depends on the physician. Honestly, I found out a little bit more about that, and I'm so glad I ended up with uh, a really skilled physician
Mhm.
that placed it and did a really good job.
Okay, so you got it cut, and you said, what, a couple hours later, your water broke. Take us through that story.
Yeah, actually, the complete story is I was due to have it clipped, whatever, I think it was, maybe it was the next day. But this day, I believe it was Wednesday, I was standing at the sink doing dishes, and I was like, ooh, I think I might have leaked some amniotic fluid. I say think because I, ever since my son was born, I've had some urinary incontinence, like a tiny bit.
Sure. You're like, did I
And
pee or was this something else? Yeah.
exactly, I didn't know, but I was like, I don't think it was pee, because usually that happens when I know I'm like, oh, I need to go. I'm just gonna hold it, and then like, and there was nothing of that. So I go in and I to the bathroom. I'm like trying to do the sniff test. Is this urine? Is this fluid? I'm not sure. And I'm like, oh, all right, I'm gonna call my OBGYN. I'm sure he's gonna want me to come in, which is great. I'm supposed to go in the next day anyway. And I'm like, he'll probably just cut it today. And sure enough, that's what happened. They fit me in about 4 o'clock. They cut it. He checked me. I was somewhat dilated and somewhat effaced. I can't tell you the exact numbers at this point, but he said, I wouldn't be surprised if she comes within the next 24 hours. And he told his partner who was on call that night, let her know. And sure enough, it was 2 in the morning that it was a very clear, okay, this is my water broke. It interestingly enough had happened with my son as well. And that's why I was a little confused about the being at the sink, because it wasn't a full gush like it was with my son. It was just a bit. My OBGYN thinks that, yeah, she was starting to, you were probably going to start going into labor anyway. So it wasn't maybe necessarily the cerclage. It's hard to tell, but the combination is it was clipped. My water completely broke, so to speak. Big gush of amniotic fluid at 2 in the morning. And I told my husband, I'm like, okay, honey, here we go. Are you ready? And we were so fortunate. Good friends of ours, my son, another boy in my son's class, were really good friends with their parents. And I had talked to her that day before, and she had offered previously to keep Miles when we go into labor. And I said, are you sure? Like, even if it's in the middle of the morning and middle of the night? And she's like, yes, yes. So sure enough, I call her at 2, and she's like, come on over.
What a great friend.
I know, absolutely.
Yeah. So at that point, were you like excited, like, let's get this baby out, or were you nervous? What was going through your head?
Definitely a little bit of both. Yeah. I remember honestly being really nervous with Miles when we were getting close to his due date. Just really scared. I'm like, honey, I'm scared. And yeah, driving to the hospital with Eva Hope, yeah, I remember being both excited and scared.
Hmm. Yeah. So, okay, now you get to the hospital. Then what happens?
We had an amazing doula that, interestingly enough, she used to be my suite mate at the office space that I would share with her. She would be here on different days.
Fun.
And that's how I met her. Yeah, she's an amazing person. And so I called her, and she met us at the hospital, and we got there, and she was really supportive, and things progressed pretty quickly, more quickly than they did with Miles, for sure. My birth plan, so to speak, with both Miles and Eva Hope was, okay, I'm not going to put any pressure on myself. Like, no, I want to have a beautiful experience. And if that means we're able to birth these babies naturally without any medication, anesthesia, perfect. Or if it means I need an epidural or medication, that's okay too. I just knew I didn't want to check out. And in the past, when I've had pain for different things, I have checked out, so to speak, and I wanted to be as present as possible. So for me, it worked to have an epidural. It was amazing. At the same time, I wanted to feel as much as I could, but I was getting really tired, and the doula had some excellent ideas of positioning, and I was trying to remember the things that the nurse told us to in our class. And we tried so many things, and I was like, I think it's time for that epidural.
Did you think the doula helped speed things along in the process?
I don't know if the speed was changed at all from her. I mean, obviously that would be hard to tell
Sure.
for sure,
Yeah.
but I definitely know it was just so wonderful having her support. It took off a lot of pressure for me wanting my husband to be
Mhm.
everything.
That's so true.
And yes, as it is, he's not great with hospital stuff or blood, and so he could take care of himself, like, and I didn't have to worry about him. Like, was he getting tired?
Yeah.
And did he have what he needed? Like, the doula would just say, okay, yeah, I think it's time, like, do you want to go get something to eat? I've got it, kind of thing. And she was always there. So that was wonderful. And he could take a rest in the chair. And you know, because I can imagine it's stressful for the guys to see us going through
Yeah, oh,
so
yeah.
much pain and
Mhm.
feeling like they can only help so much.
Yeah. And what do I do? How do I help?
Exactly.
Mhm.
Yeah, absolutely.
Yeah. So how long was your birth and labor?
Yes. I always go back to Miles because I feel like I have a better memory of his. His was long. His was 26 hours of labor, and Eva's was much, much shorter. See, 2 in the morning until 4 that next day. So we're talking more closer to half a day versus a full day of labor for our first.
Yeah. So you had your epidural, and then how long was it from there?
Yeah, that's a good question. I really should look at that. It was wonderful to have the doula there for many reasons, but one was she took really good notes. So I have
Oh,
all the
nice.
detail. Yeah, it's excellent. All those little details that I'm sure that my husband would remember. I definitely would remember, still don't. And so, yeah, I still a bit of time. I want to say I probably had the epidural about halfway through those 12 hours. I'm guessing. I would have to
Mhm.
look back on it. And then the pushing was much shorter though. With Miles, I pushed a really long time, like 2 to 3 hours, and he ended up being a forceps delivery. That was the only kind of odd thing that happened with my pregnancy and delivery for Miles. With Eva, much less pushing, much less time, maybe a half hour, or maybe not quite, but it took a few pushes, but much faster and no forceps needed. She was much smaller too, or she was a pound smaller because she was born a little bit earlier.
Mhm. And what was important to you after she arrived? Like skin to skin, the delayed
Yeah.
cord clamping, stuff like that?
Yeah. We did both of those. And I really, the skin to skin, trying to think of the correct terminology, infant crawl, maybe. There's some type of called a crawl, where basically the infant, your baby, is placed on your belly and they're allowed to actually crawl up to your breast because they smell the milk, and that's supposed to really even help the whole breastfeeding combination.
Mhm.
We did that with my son. I think our first doula, or a doula with him, had recommended that, and that was amazing. It worked so well. I had absolutely no problems breastfeeding with him. So that was our plan with Eva. And I just have to remember, like, things don't always go as planned. And sweet girl, she needed surfactant, like I mentioned, for her lungs. I was able to hold her and be on my chest for a while, which was amazing, and skin to skin. But it came to the point where she was making these little noises. It was like, oh, like, is that her little chatting? And the NICU nurse is like, no, that's actually her trying to get good breaths. And I think we're going to need to help her give her some oxygen and see how she's doing, kind of thing. So it ended up, that's when they determined, hey, I think she's going to need a little more assistance. Than
Mhm.
you're probably not going to go home tomorrow, or we're going to at least need to keep her overnight, kind of thing.
Mhm.
So unfortunately, we couldn't do the full infant crawl with Eva.
Yeah, that's too bad. Was the placenta or anything else important to you afterwards?
I think we talked about that, but we didn't make any decisions with the placenta. We
Mhm.
didn't do anything special that I remember. It was kind of a whirlwind, you know. We had in the back of our minds, yeah, she might come early because of the cerclage and they're going to clip it, or she might come on our due date like our son did. So I was vacillating a bit. Honestly, I think I knew she was going to come early. I had this the intuition, the gut feeling that she was.
Yeah.
However, we were ready. Like, there wasn't anything major that we didn't have planned, but it wasn't like we had gone through the birth plan a million times in our head. You know, it was more like, okay, yeah, we're just like keeping up with life and like,
Yeah.
oh gosh, here we are. And she's coming.
Yeah. So how was your recovery?
Oh, it was so much easier than our first pregnancy or my first postpartum, honestly. I think because things are just stretched out. She was a smaller baby, so that helped. I didn't have any tears. I had a tear with Miles. She wasn't forceps delivery. So I didn't even need I forget, shoot, I wish I remembered the name. There's a really cute name for the ice. They stick a pad, they soak a pad with water and stick it in the freezer. It's a really great trick. So you get this iced pad to stick in your underwear to help soothe you where you hurt after postpartum. And I didn't even need any of those with,
Wow.
yeah, postpartum with Eva. Yeah, it was beautiful. So yeah, I was pretty much on just a high. I was just a high. I mean, I was sad that she was in the NICU and a little nervous about it, but felt really good physically.
Hmm.
And we would walk from our room to the NICU and spend time with her, spend as much time as we could with her. And then we'd sleep in our room until we were discharged. And then trying to remember, I think I just slept in the hospital with her even when I was discharged. And the tough part, I mean, it was tough seeing her and having her there, but also she was breastfeeding, but they didn't think she was getting enough. So they were supplementing with donor breast milk, which was wonderful that they had that. But I wanted to make sure she was able to feed well enough so we can get her home. I know it was also bottle feeding such a small baby that we really didn't do much of that with Miles until he was maybe a month or two old. Then we started adding the bottle with breast milk just so that I was working anesthesia at the time, so I could do night shifts and my husband could feel comfortable being able to feed him. So yeah, that was a challenge and being worried about my milk, and the nurse kept reassuring me it just hasn't come in, it's okay. Like, and then sure enough, like I think it just took some time and it was different than it was with Miles, maybe because I couldn't have her on my chest as long and I couldn't have her with me all the time. Like she had to be under the bilirubin lights and all this. That was a little challenging for sure.
Yeah. How was breastfeeding once you got home?
Things seemed to be getting better at the end of her stay, so day 5 of her life. And then we did go to, so we didn't have any formula on hand because we never really needed that with my son at first. Eventually we did, but when I stopped breastfeeding him. But so yeah, I remember stopping at, we have a natural grocers around us. I was like, okay, let's go in there, try to find a best looking formula and just have something in case we need it, kind of thing. But honestly, we never used it. We ended up passing it on to somebody else. The combination of the two of us ended up working out well. So I was happy about that.
It's great. And mentally, how were you?
Luckily, I never had any postpartum problems. I feel or postpartum depression, I should say, or emotional problems. It, if anything, for me, the oxytocin from breastfeeding, I think this is my take on it, just it helps me feel just very elated and wonderful and on the upside of the scale of feeling down. So that worked out great. And something I do remember, however, with Eva that I don't remember, I'm 99% sure did not happen with Miles, is I was having some short-term memory problems with Eva during the day. And I think it was because I wasn't getting good sleep for a while. With Miles, my husband helped a lot at night. And with Eva, my mindset was, well, I have off work, Jeff doesn't. I'm going to let him get some good sleep. I'll just get up with her and I'm going to have to pump anyway. So I might as well just get up, be the one that's getting up. And so I had interrupted sleep for quite a while. And I really noticed that with my short-term memory, I was like, oh my gosh, I know we talked about this, but I can't remember specifics. And it was a little scary. I was like, geez, like, yeah, definitely our bodies need our sleep. Like,
Yeah.
and then maybe as we get older too, that it's a little harder to rejuvenate unless we have a lot of sleep, or at least for me, that was my experience.
Yeah, definitely. Is there anything else you want to mention about your pregnancy or birth?
I remember when Eva was born, just laughing and crying at the same time because I couldn't believe, like, oh my gosh, she actually came out. Like, I don't know, like it was like all of a sudden, like here she is, and it was so beautiful. It was so amazing.
One
It
thing I forgot to ask was what was the donor selection process like?
was really interesting because I we looked at we wanted to do a frozen embryo. We didn't want the extra stress of having a fresh
Mhm.
donor. So we just looked at the frozen, and they had pictures and tons of information about each of the donors. And
Mhm. Like you're back on Match?
yes, it was really kind of odd at first. I'm like, this is kind of weird, but I'm
Mhm.
really good with it. I'm really good with it.
Mhm.
And we had some stipulations. We did not want the eggs from anywhere outside of Colorado.
Huh.
We live in Denver, and the bank that we worked with is close to Denver, and we did not want to have them shipped because I read something in their contract is like, we're not responsible if something happens to the eggs on the shipment. Or I'm like, oh goodness, that's just an extra layer of stress. We don't need that. So that was a stipulation. And I believe the number of eggs, my husband and I had decided on a number of eggs because we didn't want to end up with too many embryos, but we also didn't want our chances, the shot to end up without any embryos.
Mhm.
So it was a bit of talking to the RE and deciding on what felt comfortable. So the way that the clinic we worked with has it set up, it was groups of 8, I believe, and then sometimes there would be an extra few eggs there that didn't fit nicely into the group of 8. And so it ended up there were only 2 donors that had the potential of us getting the number of eggs that we wanted and that were local.
Wow, 2. That's quite a
2.
small pool.
Yeah, and another piece of it, totally, but it helped us narrow it down. And another piece was I have always thought cultural genetic race combinations, when a man and woman come together, their babies are so beautiful. Not that just white babies aren't beautiful too, but I just thought it would be really cool to have a mixed race baby. And my husband definitely felt differently. And he's like, I think it's going to be a whole lot easier on the baby if he or her looks like us, more like us.
Mhm.
And I was like, okay, that's a point there. So I was good with that. The donor actually ended up having light hair, green eyes, so close to my being similar to me. I did see on there that her father was from Spain. And so in the back of my mind, I was like, oh, that's where we could get a little bit like
Mhm.
some genetic changes in there. Not that America is like Europe transplanted here, of course, but I, I was like, oh, he's 100% Hispanic. And it just felt cool because my son's going to language immersion school, and it just felt like, oh, this is going to be good. And they were talking about on our ultrasound how they could see Eva's hair on the ultrasound. And I believe that was the first time I thought, oh, I bet she's going to come out with dark hair. They're like Spanish background. And sure enough, like she came out with a lot of hair. I think our son had some hair, but it was so light you couldn't see it. But Eva, you could see it. It was
Wow.
not black, but it was dark brown, and
Hmm.
it's lightened up a bit. It's probably say late brown now, but yeah, it's just funny how you kind of
Yeah,
plan things and maybe they don't always come out as planned.
definitely. So how did you choose between the two? You just went with a Caucasian one between the two?
You know what? I think they were both Caucasian. I think this
Oh.
one was looked more like me. I can't even remember honestly with the other one, but I want to say she didn't have features as similar to me. And then also the fact that she had that Spanish background with her dad. I don't know. It just made it feel like, yeah, that feels right. For both
Hmm.
my husband and I are like, yeah, let's do that one.
It really seems like it's a theme with people using donor eggs that it's like all of a sudden this is the one and it makes total
Just
sense.
feels right.
And so you have two embryos left frozen. What are your plans?
So this was a big topic for my husband and I stress if anyone goes through the IVF process that it's a really good discussion. I know especially another good friend I've met through this process, she and her husband are having a bit of a difference of opinion. And I think it's because things have changed too after they experienced it. One person changed their mind about what feels right.
Hmm.
So even you have the discussions, you might run into this anyway. But for us, I knew personally that I felt we needed to decide like what were we gonna do because I didn't feel okay with some options of the embryos. I didn't feel comfortable with discarding them. I didn't feel comfortable with donating them to research. That's just my personal thing. I don't judge anyone. Like we all have different things that feel right. And so I wanted to make sure my husband was comfortable with it. And the RE said, oh, there's the option of adoption. And honestly, I don't even think I knew that. And I was like, okay, that feels good. That's an option. Possibility of having another child. Honestly, that's where we're in the heat of
Hmm.
it, the heat of the decision. So I guess stay tuned.
That's exciting. What has been your biggest challenge being pregnant at 48?
Oh, I'm glad you just asked that because I hadn't thought of it before. My mind usually goes to how I feel physically, and however, I think the biggest challenge is my own judgment and my fears of other people's judgment. Honestly, is like, what are people going to think of me? Like, I'm pregnant when I could have grandkids.
Hmm.
Like, there are people my age that have grandkids. It's very common. And so, what are people going to think of me? Honestly, has been the biggest challenge,
Yeah.
interestingly enough.
Is there anything you recommend that would help prepare someone for pregnancy and birth over 40?
I would stress lifestyle, like being as healthy as possible. And it's such a beautiful thing. And that it's part of my baby hope fertility business, so to speak. Fertility clinic is looking at that, like the functional medicine approach to fertility and getting couples healthy. And what I love so much about it is it's generational. So when we get ourselves healthy, we are going to stay healthy because it feels good. We feel good. And then we pass that on to our child. Like we can have a healthy child and we pass that on. And our child's going to grow up in that environment and most likely have the similar lifestyle choice, make the similar lifestyle choices that we did because that's what he or she knows. So I just love that. And so I would stress for me, I think good quality sleep is important, 7 to 8 hours. drinking lots of water. I have a friend that says water cures everything. And I think for the most part, it really can. We need to stay hydrated. We're made of mostly water. So hydration, and then good quality foods, just thinking about like we deserve it and our babies deserve it. And this is our babies, this is the environment that they're going to develop in. And generational, if they're female babies, their eggs for their babies are growing inside you as well. So
Yeah.
it's just so powerful. Like what just some simple things of eating lots of vegetables, trying to eat organic when we can, looking at the clean 15 dirty dozen if we can't always buy organic, and staying away from processed foods, trying to just anything that might be inflammatory. It can be different for different people, but if you notice something like doesn't make you feel good, yeah, like let's stay away from it, kind
Hmm.
of thing. And then, yeah, good exercise and not trying to push ourselves too much, like listening to our bodies, like that all is really helpful for me and like what I found on my personal journey.
Yeah. I know for me, I probably need to hear that myself. But being in the first trimester, I am just eating whatever I can actually stomach to eat.
Yes, absolutely. It is hard. It is hard in the first trimester. Totally.
Yeah.
Yes, yes. And to give yourself grace that you're not going to do it perfectly,
Yes.
but as much as you can, like whatever you can to not, it's when our glucose levels peak and fall, that's when we can experience even more nausea and feel worse. So
Mhm.
it's hard though, because we crave that energy, especially that quick energy from the sugar. But if we can try to get something that's more sustaining, like protein, good quality proteins, the veggies, I know it's easier said than done. I really found, especially with Miles, that gum, a friend of mine said, oh my gosh, gum helped me so much with my nausea, and just chewing gum, like such a simple thing. Like,
Huh.
oh, beautiful.
I'll take it. I'll try it.
Right? Try it. Absolutely.
Yeah. Well, tell us, how did you come to your fertility practice?
As an anesthesiologist, in the back of my mind, I really enjoyed my work, but thinking, gosh, it would be nice not to have to work nights and weekends and holidays and miss some of my son's performances and games and important things. So in the back of my mind, I was like, oh, maybe at some point I'll do something different, but I wasn't really seriously thinking about changing paths at that point. But I did get into functional medicine. There was an online course through the Institute of Functional Medicine. They're somewhat associated with Cleveland Clinic, I believe. And I just loved that. I just loved every minute of it. I thought a lot when I was working with patients in anesthesia, like, gosh, both of these patients look healthy, but then this one on paper or in their chart has all these lists of medical diagnoses and problems, and the other one doesn't. And like, why are people so different? And just going through my functional medicine training, it's just so interesting looking at the root cause of problems. Where in the Western world, how I was trained, and I'm an osteopathic physician, our medical training, MDs as well, it was very similar, minus the hands-on piece. But we're taught like, oh, you have this symptom, well then we need to get this diagnosis and look at this treatment, versus like why do you have this symptom and this symptom and this diagnosis and this diagnosis? Maybe there's one common underlying thing, or maybe there's a few underlying things. And it's just, to me, so fascinating. So I was so glad that I had already started looking into functional medicine, taking this or getting into this program. It's a certification program. And probably around the same time, let's see, yeah, I wasn't completely certified, but I had noticed my hands were getting weaker, or I didn't feel as strong when I was at work as I normally do. And as an anesthesiologist, that's very important, because a lot of times you end up intubating a patient. So that's lifting their head with they they go to sleep with, they're ruled unconscious with medication, and then inserting this laryngoscope, it's called, but it's this big metal apparatus that goes into a patient's mouth, lifting the mouth and inserting a breathing tube. so to speak. And that's how they're kept viable, alive during surgery, but, pain-free because they're unconscious. So it's very important to be able to hold, especially I was noticing like the bigger guys, their big heads, I would really have to line them up correctly to be able to do my job and get the breathing tube in safely. So I, after exploring things a bit, I found out that I had a carpal tunnel, so median nerve compression in both hands and ulnar nerve compression. So part of my journey took me to an occupational med doc. And the day I went to see her, she said, "You're too weak to work as an anesthesiologist. You need to," she's like, "I can tell by your personality, you're that type of person that would, help out your partners and take any case." She's like, "Don't do it. It's on your medical record that you're too weak to work. You cannot work tomorrow." I was like, okay.
Oh my gosh. Like she fired
Yeah,
you.
exactly. I was done, but it was quite a shock. However, looking back, I'm like, it's probably the greatest blessing because I would have had a really hard time firing myself.
Yeah.
And she did it for me. And I had this functional medicine program. I was already deep into, I took the written test, the oral, there was a written and a computer and then a written case study. I did that shortly after and I was certified and I was like, okay, yeah. And then I'm on this WhatsApp group for the functional medicine training, and there are tons of posts because there are tons of people on there, but I happened to see who's interested in learning more about the functional medicine approach to fertility. I was like, oh my gosh, I am. Because I'd even thought about that before. Like I wanted to specialize in it, but I had no idea where to start because in the IFM training, there's nothing like really specific about fertility. There's like general helping people get healthy, obviously, but not specifically in hormones for fertility and the specific approach. So I was like, yes, sign me up. It ended up the first class started on my birthday. I'm like, okay, if that's not a sign,
How
like
fun.
this is great. Yeah.
Yes.
So I completed that and said, all right, I'm gonna take this program that this naturopathic physician is the one that had the course. She basically perfected it over her 15 years of working with couples. And it was this beautiful gift I felt like given to me, like, oh my gosh, here's like what works. Here's what hundreds of patients have had healthy babies because they've done these things, these steps. And I mean, it's not just steps, it's more specific for each person because functional medicine is looking at the root cause and digging in individually. Oh, yes. So Baby Hope Fertility. It was fun to give both birth to both the business and baby Eva, and both of them having the name Hope in their names.
Yeah, I like that. So how can people work with you?
Right now, I work with couples and I make sure that the guy's on board as well because my mentor, Dr. Amatma, who I trained with, had mentioned this. And then I think I had to find it out myself where it was the male of the partner was not willing to look at his part in the equation where the eggs 50%, the sperm's 50%. So they're both very important. And that was definitely a frustrating piece. So I do like to talk to both people to make sure we're a good fit.
I like that.
And yeah, so that's Baby Hope Fertility. And I can tell you more about what we do. And then also, I'm super excited about, I'm partnering with one of the women I trained with, and we are starting a group fertility. So it's the same program that's helped hundreds of couples have healthy babies. And these are couples, not everybody, but that have tried, some of them have tried IVF, some of them have tried various things. And we're still able to help them through this program it's a holistic fertility program to get pregnant. So I'm partnering with the woman I trained with, and we're bringing the same program to couples and groups. So I'm super excited about it because, as I have mentioned in my story, I found the group setting so beneficial to know that you're not alone and have that support of other people going through similar things at the same time. So, super excited about having that same successful program, but being able to incorporate the group as well.
Yeah, it's really great to meet other people too in the process.
Yes.
So I know I have a lot of questions from my audience. I believe that they probably have. If we could get to those, I'm excited.
Yeah, absolutely.
So many of our listeners are trying to conceive naturally. What advice would you have for them?
Yes, lifestyle is very important. Stress, and I like to say stress resilience versus just get the stress out of your life. I mean, obviously, we have to be real. We're always going to have stress in our lives. It's just part of being a human being. So
Yes.
it's how we cope and how we go from our bodies being in the sympathetic state of the fight or flight is your sympathetic state. So your sympathetic nervous system where your heart rate's going and you're anxious and you're like, okay, you have to get this done and I'm worried about that, to we're going to go to the parasympathetic state where we're rested, we're relaxed, and giving our bodies that opportunity during the day is so very important. I love meditation and I'm relatively new to it and it has helped my life tremendously. So I like to stress that part with the couples that I'm working with.
Mhm.
But if meditation is not for you and not everybody wants to meditate or it doesn't feel right, there are other ways to get your body in that parasympathetic state, whether it's just taking a few nice deep breaths and being mindful of breathing in and out and a longer exhale. So that will also help your body transition into a parasympathetic state. Maybe it's taking a walk out in nature if you have a few minutes or doing yoga. There's various options. I think that's very important. Eating as healthy and clean as possible is very important. Sleep is a big piece. Hydration, definitely.
Those are good ones. And I've heard a lot about women not having money for IVF. So, what would you say to those women?
Yes, I am finding more and more, and it might be because I'm in Colorado, that insurance companies are covering reproductive endocrinology. So I would say it's worth a look into your insurance, and you might be pleasantly surprised that they cover more than you expect, or they cover almost the whole thing. So that's a part of it. And then there's also, gosh, I wish like things would change, and I'm hopeful that it will in our medicine and our way of treating patients and looking at root cause and knowing that there is something in between. Okay, I'm with my OBGYN, we tried Clomid, now they say go to the reproductive endocrinologist, and the reproductive endocrinologist says your only chance is IVF, and that's a very low chance. There's a lot in the middle there.
Hmm.
There's looking at it from a holistic lens and a functional medicine approach and optimizing both couples' health. And it's so important. Even I work with quite a few patients, honestly, who are going to the reproductive endocrinologist for whatever reason it might be. And they want to be optimized for that. They want their best chances. And that's another piece. If that is somebody's approach, I highly recommend getting as healthy as possible before that to increase chances of success.
That's really good. I've encouraged a few women to even just talk to someone else, like get another opinion. You never know what other options you have out there unless you just look for them.
Absolutely. So true.
And a lot of women have also mentioned low AMH. What would you say to those women?
Yeah, the AMH does not define you or your fertility is what I would say.
Good
But
one.
and that's yes, that's what I like to say a lot. We like to look at we do look at AMH and
Mhm.
as the holistic approach. Absolutely, we look at AMH, but we also look at FSH and your other hormones, like your day three labs are really important. And if we see somebody's AMH quite low, the FSH high, meaning like in the 20s, and their age in the 40s, then we might say, well, your chances might be a little lower of natural fertility because your hormones, you might be perimenopause and your hormones are shifting a bit. But we have seen women with AMH levels below one and have gotten pregnant naturally. So,
Wow.
yes, yes. So, that your AMH does not define your fertility. Absolutely not. Absolutely not. And we've also seen, I've repeatedly seen AMH increase, which is crazy and so
What?
cool, right? Has
Fascinating.
increased as we work together. Yes.
Interesting.
Um,
I'm sorry, what's a
yeah.
baseline? Like you said, AMH less than one is super low. What's like an average or we would expect to be in our 40s?
Yeah. I wouldn't say, sorry if I said less than one is super low, but
Maybe I took it like that.
yeah, no, because definitely we've seen AMHs of 0.003 and lower than that, I would be concerned that that might be a challenge as far as natural fertility to get that number higher. But absolutely, in the point one, we've seen that number rise, and we've seen people get pregnant with an AMH that low. But again, it's not just the AMH. Like we're looking at the other hormones because if a
Hmm.
person is perimenopause, it's much more challenging to, and sometimes not possible for hormonally for a natural pregnancy to work.
Hmm. What would you say is a normalish range of an AMH number in their 40s?
Gosh, that's a really hard question because there really is no standard. I mean, you might see different ranges when you Google it, but
Hmm.
as far as a Western medicine has not come up with a standard of AMH for
Hmm.
each age. And I have read that that's because, I mean, we've been using testing AMH for a while. You think we could, but apparently somebody hasn't really organized the data to come up with like these are your numbers or where you should be. And we see a huge variation, honestly. If somebody has PCOS, their AMH is going to be quite a bit higher because many times they're not ovulating. So they have a larger egg
Hmm.
reserve and their AMH is going to be higher, but it doesn't mean necessarily that they have good quality eggs. And if their hormones aren't lined up, then it doesn't matter what their
Sure.
AMH is because if they're not ovulating,
Yeah.
then they're not going to have success with natural fertility. So yeah, I just like to advise people like don't put all your eggs into the AMH basket because there's so much more to your fertility than
Yeah.
just your AMH.
That's really good advice because I know a lot of women get stuck on that number.
Yeah, it's easy to do. Absolutely. Same thing for me. Absolutely.
Yeah.
Yeah.
How would you help somebody if they aren't ovulating or even have a cycle at all?
Yes, that's a good question. We would do what's called a progesterone withdrawal. So we would start progesterone and then do a withdrawal bleed. And sometimes a person's cycle will start to regulate from that. And
Hmm.
then other times it's looking at all those lifestyle pieces and just even changing that with maybe doing the progesterone piece to see if we can to get the cycle going again. But it depends on the like the root cause. Like I love to go back to the root cause of why is the person not having a cycle? Is a person not having a cycle because they were on birth control for a long period of time? Then yes, there are things that we can do to probably help reset that. Is it because menopause has set in or is close perimenopause? then maybe not. Like we
Hmm.
might not be able to change that. Is it because dietary or lifestyle, over exercising, or just stressors on our body that we're not cycling? Yes, most likely we can make changes that the cycle will come back.
Hmm. I love that. Good. It's so refreshing to hear that they can come back. It is possible.
Yeah, definitely we've seen it. Uh-huh.
Good. And what are your tips for improving egg quality?
Ooh, yes. So many things we can do to improve egg quality. Are going back to the lifestyle pieces. We want to make sure oxidative stress is so hard on our reproductive system because we have cell turnover, and our gametes, meaning our eggs and sperm, are just really susceptible to oxidative stress. So oxidative stress can come in many forms. It can come from toxins, it can come from air pollution, it can come from lack of good quality sleep, any kind of stressor. So really trying to change any of that for the better, meaning, you know, trying to look at even our house. I tell the people I work with, I'm like, I used to go to Target thinking, oh, okay, I'm at Target, like not thinking anything, honestly. And now I'm like, oh my goodness, I went to Target and brought home toxic stuff. So just going through our house and looking at what products. I like the Think Dirty app. You can scan codes, and usually it comes up, and trying to keep your products a 4 and under, so those are more clean. Whatever way you can, try to look and see, are your products clean, and if they're not, swap them out. And it takes a while. Like we went through our house, it took a while to do all that. And even thinking about your cookware, you do not want to use nonstick cookware because of the toxins that are heated and get into your food. To looking at eating organic, like I had mentioned before, and any other toxic like beauty products, like looking at those to see if they're as clean as possible. We live in a world that has toxins, so there's there's things that we can control, and obviously things we can't. If we can change the things we can, that's that's great, and that'll be helpful. And then also eating as clean as we can, getting good sleep, or like being really conscious of that, and listening to our bodies. Wherein movement is wonderful, especially movement outside, but we don't want it to be a stressor too. If we've definitely seen over exercising as a stressor that causes oxidative stress that can decrease our egg quality.
Mm-hmm. Makes sense. And my last question is back to you in your pregnancy.
Mhm.
What advice would you give yourself when you were pregnant if you could go back?
I would like to say, hey, let's focus on every beautiful moment and try to let go of the fear and anxiety. That was really hard for me to do.
Mm-hmm. I feel that a lot for sure.
Yeah, easier said than done. But
Yes.
like looking back, I'm like, oh, there was no problem. But yeah, like when
Mm-hmm.
you're in it, you don't know. You just don't know.
Yes. And what would you say to all those other women in their 40s who are trying to conceive?
It's so important to dream and believe and have hope. Like that's what I really needed. And this was a big piece of my story I forgot to tell. I we had so many losses and sadness, meaning our pregnancy loss, and then the IUIs that we attempted that didn't work, and the IVF that didn't work, that I lost hope. And I'm normally a really positive person, and I was trying every trick that I knew. Like, oh, I could not make myself have hope. And I finally was like, okay, universe, I can't do it. I'm just giving it to you. And somehow I ended up opening up to my son's classmate's mom. So I didn't even really know her. I wouldn't say she was a friend at that point. I ended up opening up to her. I went over her house with my son for kind of a play date and told her our process, and we were about to do the donor and where we were, the donor egg. And she was so excited for me, and I just opened up that I was really scared about it because I had lost hope, and I knew that was a really important piece of things, and I couldn't force it back. And honestly, I can't remember what she said, what she didn't say, what happened, but something shifted and I had hope. I had hope. So to me, that's so important. And I just want to give all you women hope, and I admire you for having this dream and the courage to dream it.
That's perfect. And Jeanie, will you give us your Instagram and your website so other women can connect with you?
Yeah, absolutely. Babyhopefertility.com and at Baby Hope Fertility. And then our group program is positivityfertility.com, and kind of the same thing for the Instagram. So you can find me either place, and I'm super excited about both of them, especially the group piece that we're starting.
Yeah, wonderful. Jeanie, thank you so much for coming on. It has been a pleasure.
Yeah, absolutely. Thank you so much for having me. It's just some quite an honor.